Positive HPV test. Does it mean cervical cancer? A positive test for high-risk human papillomavirus, or HPV, can raise concerns, but it does not mean that a person has cervical cancer. Instead, it indicates that HPV types are present that could potentially lead to changes in cervical cells. If these changes are not monitored or treated, they may develop into cervical cancer over many years. HPV is a very common sexually transmitted virus. By age 50, about 80% of women will have been exposed to it. Most HPV infections are temporary and are cleared by the immune system without causing any harm. However, persistent infection with high-risk HPV types can lead to precancerous changes in cervical cells. This condition is known as cervical intraepithelial neoplasia, or CIN. If left untreated, CIN can progress to invasive cervical cancer, often taking 15 to 30 years after the initial infection. Screening programs use HPV testing to identify women who are at a higher risk for cervical cancer earlier than traditional Pap tests alone. When a woman tests positive for HPV, it prompts closer follow-up care. This may include repeat testing, cytology, or colposcopy, which is a detailed examination of the cervix. These steps help detect any precancerous lesions early on. Early detection and treatment of these lesions are crucial in preventing the progression to cancer. It is important to note that the risk of developing cervical cancer after a positive HPV test can persist for decades. Therefore, ongoing monitoring is essential. Women who test positive for HPV should remain in screening programs until the infection clears and any abnormal cell changes are addressed. In summary, a positive HPV test is a marker of increased risk for cervical cancer, but it does not mean that cancer is currently present. It serves as a critical tool in cervical cancer prevention. By enabling early identification and management of precancerous conditions, it helps reduce the incidence and mortality of cervical cancer. Regular cervical cancer screening and follow-up after a positive HPV test are vital for protecting reproductive health. Always consult healthcare professionals for personalized advice and guidance regarding your health.